It's titled The Role of Academia in Public Health Research, Bridging Theory, Practice, and Partnerships. I'm Dani Fallon. I am Dean at the Emory University Rollins School of Public Health and chair of the ASPPH Research Advisory Committee, and have the privilege of being your kind of moderator for the day. My own training is as a genetic and epigenetic epidemiologist, and I have led lots of research from federally funded agencies like NIH and CDC over the years, primarily in neuropsychiatric disorders. And I had the privilege previously of chairing the Department of Mental Health at the Bloomberg School of Public Health before moving to Emory. And so it's my pleasure to serve as moderator today. We have lots to talk about. Before we begin, a couple of quick notes. This session, as you just heard, is being recorded, and the recording will be available to all of our registrants afterwards. And please use the Q&A feature of the webinar to submit your questions. You can do this at any time, but we'll reserve them towards the end of the address to respond to as many as we can. So today, we're focusing on how academia continues to drive high-impact collaborative research despite today's funding challenges. And we're going to talk about how research that we do as academic public health shapes public health policy and practice through our deep collaborations with our practice partners, both in providing evidence to fuel best practice, but I would also say in training the public health workforce with the skills most tailored to modern needs, and including an understanding of the interplay between research and practice amongst that workforce. We each have important roles to play, each meaning our academic public health institutions, as well as many other parts of the public health ecosystem. And the current environment has challenged that ecosystem. So we'll hear about how we can adapt and continue the high quality research and education that we do in collaboration with government and with other research and practice partners so that we ensure that public health moves forward. So I am delighted to introduce our distinguished panelists today. First, we have Dr. Melody Goodman. She is Dean of NYU School of Global Public Health. She's a biostatistician and research methodologist whose partner-engaged translational research develops solutions to improve urban health outcomes. She has published widely, advanced methods for community engagement, and received national recognition for her social impact. So welcome, Dr. Goodman. And then we had originally planned to be joined today by Dr. Andrea Baccarelli, who is the Dean at the Harvard T.H. Chan School of Public Health, as well as Dr. Jason Asher, who is the head of CDC's Center for Forecasting and Outbreak Analytics. Unfortunately, both were unable to join us today. So we're super grateful that instead we have Dr. Sean Gibbs, Dean of the Texas A&M University School of Public Health, as well as ASPPH's own Tim Leshin, Chief of External Relations and Advocacy Officer, who have kindly agreed to step in. So thank you both and welcome. So Dr. Gibbs has been Dean at Texas A&M for, I think, and Sean, you can correct me, about 6 years, and a big collaborator amongst the deans in the ASPPH environment. His research has helped determine policies and procedures for industrial hygiene in highly infectious disease responses. And he's a leader in public health education as well, and represents public health interests in a number of areas. So we're so glad to have you joining us. And then Tim Leshin, I already mentioned his roles as external relations and advocacy officer. Tim also leads our research section at ASPPH, which convenes the senior staff responsible for our research compliance, administration, and investment strategies across our member institutions. So we're really delighted that you could join this conversation and provide the really important insights that you bring to advancing research in academic public health. So thank you, Tim.
Thank you.
All right. Well, let's jump right in. I would love to hear from each of you as we start this discussion. What are your perspectives on the role of academics in advancing public health and public health research? What do you see as the most important opportunities as well as challenges ahead? And I'll give each of you around 5 minutes for these introductory remarks, and then we'll jump into some more specific questions. So Sean, why don't you go ahead?
Happy to be joining you. Thanks for having me, Dani, even though 90 minutes ago I didn't realize I was going to be here. In regards to the question here, I think our partnerships with the community, our partnerships with local health department, our partnerships with industry are instrumental to what we do on the research side. When it comes to public health, we have to be constantly engaging the communities, engaging our populations, and meeting them where they're at, and we can't do that without engaging others. We cannot do that in a vacuum. So many of us now realize that the days of helicopter research dropping into a community and dropping out of the community are no longer acceptable. We have to do research that the community needs, that the community is involved in, whether that's, in South Texas or whether that's within the oil industry. I've got a group of faculty who do a lot of work in occupational safety and health. They're constantly working with corporations to address needs and to address safety needs to improve the safety for the workers in that industry. All of us across the board have health policy and management and health behavior groups that are actively working with policymakers around implementation of programs that are going to better the health results within our communities. And I can't say enough for all of our epidemiologists and biostatisticians who are working hand in glove with the health departments and the organizations out there who are bringing in data who don't particularly may not understand how that data can be utilized. And I know that's a hallmark of a lot of the work that many of the people on this panel have done, is really exploring those relationships and utilizing that to answer questions that people didn't even know that they needed to ask. So when it comes to what we should be as academic public health research, yes, we're in the laboratory. Yes, we're in the theoretical. But we were born and bred in the communities. We were born in the population. We're here to address the needs of the entire country and the states and the regions that we serve. And we have to be heavily involved with them. We have to be cooperating with them. We have to be sharing information. That doesn't mean we're going to agree all the time. That doesn't mean that we're going to be lockstep. But we have to have those conversations, and we have to have those disagreements and agree where we can so that we can move the science forward, help people understand the science. And right now, one of the big things that I'm pushing here is help people understand better that science evolves and changes, and that new information coming along doesn't necessarily mean someone was wrong before. It just means now we know more. Now we have the ability to test in different ways than we did, and now we understand how things react in a different situation. So with that, I'll pass it on to Dean Goodman.
Thank you so much, Dr. Gibbs. So, Dean Goodman, you've done groundbreaking work in partner engaged research. We'd love to hear how you think about academia strengthening its capacity for both rigorous studies as well as ensuring that there are direct benefits to communities. And I think this leads well off of some of the points that Sean has made.
Thank you. Thank you for having me. And thank you to Dean Gibbs for sort of giving that opening spiel about the importance of partnerships. I think it's really important for schools of public health to be seen as a major community resource, the way people see libraries and banks and other things in their community, and that they really understand how to access and work with their school of public health to address the questions that are most important in that community. I think working together, we can definitely achieve more. And, as someone who does survey research, I often think about asking the right questions. And I think, when you work in partnership, you tend to ask better, more informed, more rigorous, more impactful questions, right? And I think asking the right questions, but also understanding the questions that your participants are answering, right? There's the question that you ask, but then it's also how it's perceived by the people who are taking that survey, for instance, in terms of my work. And I think as a biostatistician, what I really learned early on in my career is that if I wanted to have the quality of data to answer the types of questions that I really wanted to answer in my research, I had to step from behind my computer screen and really engage with the human aspect of public health. And I learned so much through that. I think it's made me a better scientist, but I also think it's made me a better public health practitioner. And I think we all have to do a better job at engaging in partnership work and partnership development and moving from behind our computers and really doing the practice of public health. In terms of enhancing the infrastructure for community academic partnerships, in 2013, I started the Community Research Fellowship Training Program. And if you know anything about a mini med school, I sort of think of this as a mini MPH. We're not trying to create public health researchers. We're trying to increase research and public health literacy so that our community partners know how to work with us, know the types of questions that we can answer, and understand the types of questions that we're going to be unable to answer, right? And understand the types of work that we can engage in together. And the best thing is when I train my partners and they say, now you're doing it wrong. Like now that we know, we can tell you that, here's how we'd like to see things go. And I think we have to be in that space where the communities really know us, because they're going to be our best marketing tool. They're going to talk about the work that they've engaged in our schools with. They're going to talk about the impact that our school has had on their community. And if we're not there, then we're just leaving a gap in that space for someone else to fill that narrative.
Thank you so much, Dr. Goodman. What I've heard so far from both of you is the importance of having communities drive the research questions that are most important to communities and how we function as academic schools of public health. But I also heard from both of you a little bit about what the definition of research in the context of public health. Dr. Gibbs, said it is laboratories, but it is also these other things. And much of what you talked about, Dean Goodman, it is the computer and the biostatistics work you do, but it's all these other things. And it sounds like both of you are arguing for more articulation of what public health research is compared to what folks' perceptions of it might be. So maybe we can keep that thread going as well as we move through. So now on to Tim. In your role at ASPPH, you work closely with the research leaders and member institutions. Can you share how the research section is helping schools and programs respond, particularly to today's challenges, and a little bit more about the prioritization or importance of research as part of the ASPPH mission?
Thank you, Dr. Fallon. Appreciate you leading this discussion, and I'm happy to talk about that. Let me set the stage a little bit in terms of, obviously, this year has been a quite challenging year for academic public health research. We've seen cuts to funding. We've seen cuts to staff at our partner agencies, NIH, CDC, HRSA, and the like. And so, this has been challenging, right? We've seen the impact and the uncertainty of the times right now when it comes to research, and especially at schools of public health. We've seen universities across the country lose funding, and a lot of times that funding has been at our schools and programs of public health, more so than other departments. So we've been working closely with our section and our research advisory committee, which Dr. Fallon also chairs, to try to respond to the moment. And so we've done this in a couple of ways. One is we were part of a law that we filed with the Association of American Medical Colleges to prevent the implementation of a 15% cap on indirect costs now, or facilities and administration costs. Now, if that had gone into effect, that would have been devastating, not only for our schools and programs research, but across the board for universities. And we managed to prevail with a permanent injunction by the judge in that case to prevent that from going into service. But we are now, there's going to be an actual trial on this case coming up in November. So we'll see how it plays out. So far, so good. But at the same time, we've spent a lot of time advocating both on Capitol Hill and within the administration for the funding that our members are dependent on to do that research. And so this has included a Hill Day in March around our annual meeting. And then last week we had dozens of our members doing virtual meetings in support of academic public health research. I'm very happy to report that one of the programs we've been advocating for all year long is the Prevention Research Centers out of the CDC. And we're just hearing this morning that at least some of them are getting their funding for FY 2025. And that does not happen without our members being incredibly engaged and working with their congressional delegations, and others at their university to make sure that happens. Now, when it comes to the section has been quite worried about a lot of these changes, and they're all trying to respond to these changes at their institution. And so the great thing about the section is people can share what's going on at their institution so that everyone feels like, well, at least we're all in the same boat. But at the same time, we really have been focused on what else can we do to support the academic research enterprise. And that's been very helpful for us to work collaboratively as a group to do that, and respond to all sorts of potential changes on the horizon. I just want to end by saying that we would far prefer to be focused on things like population health research, healthy longevity research, gun violence research, thinking about the future of research and growing research. But we've spent a lot of time, unfortunately, this year defending research. Now, the good news is we think that the Senate has produced a bill that funds these programs that is pretty good. It doesn't increase them, but it doesn't cut them, whereas the House bill version would cut the CDC by $1.7 billion. And now we're worried about whether or not the government's going to stay open. We think there could be a government shutdown before the end of the fiscal year on September 30th. And so we're working very hard to make sure that our priorities get funded after that process plays out, hopefully by the end of this calendar year.
Thanks so much, Tim, for that. And truly, you mentioned this, but on behalf of the Research Advisory Group, as well as the research section, the advocacy work and the interplay between the stories of our research and the importance that you all advocate for on the Hill has just been so critical. And you mentioned the Prevention Research Centers is just one example of many areas where you all have been working in lockstep with us so deeply, and we're really grateful. On the research section side, for any of you on here who are research section members, I hope that I think that we're also providing what Tim said, which is a place to not only focus on the advocacy part, but on the day-to-day operations. How are we managing? What are our strategies across schools when it comes to these changes in federal research landscape? And so I really appreciate ASPPH's leadership in helping to provide that support infrastructure for the research operations of the schools as well.
Yeah, that group is very engaged, especially in the last year. And so I learn a lot from working with them in terms of what's going on the ground and thinking about how we can respond at the federal level on their behalf.
Yeah, indeed. All right, well, thanks to all three of you. Let's jump into some specific questions. So I'm going to start with Dr. Goodman. So for you, when you're thinking about the future now, what types of innovation, and it could be scientific or technological or structural or other types of innovation, are you thinking academic research should prioritize to poise ourselves well into the future?
So I think everyone's talking about AI. And as applied biostatistician, I think about it a little bit differently. I'm thinking about what are the applications of AI in public health, right? So there's a bunch of my colleagues who are creating and generating sort of large language models and doing the AI development research. But I think it's important for us to really think about how can AI help us do the things we're doing better, faster, more improved, and get better quality data out quicker. I don't have all the answers, but I do think we need to think about what are the real applications of AI in our work. I know that some of our faculty here have been doing things like using AI and Google Maps to figure out parks and streets and all of these types of things. And so I think I'm really interested with the great explosion of data as this new great resource, right? They say it's a better resource now than oil. Sorry, Sean. But they're saying data is one of the world's most valuable resources now, right? How is AI going to help us take all of these data from all of these data sources and allow us to do public health even better than what we're currently doing? So that's what I'm sort of excited about in the future.
That is exciting. Thanks so much. And yes, sorry to Sean about that movement of what is the the highest priority. But I think another area that public health touches everything, right? We have folks asking us, community members asking us to understand the environmental impacts of data centers, right? And so I think we got to embrace the positives, as you said, but also recognize the public health touches everywhere.
Well, and Danny, to jump off of something that Dean Goodman mentioned there, for those of us who are heavily involved in running national and state and university COVID responses, many of us remember faxing data in still. So there's not only the opportunity to link data, but also just to move the practice side forward in ways that has been neglected for quite some time. I remember during COVID response explaining to one of the 19-year-old student workers what a fax machine was and what it was used for. They've never had to do this. So we've got the opportunity to really push that part of the field forward and take advantage of that innovation that Dean Goodman's talking about. And by the way, we're not just oil down here in Texas. We got other things too. Look, we got space.
Great. Thanks to both of you. I'll move back and forth between folks. So I'm going to jump in with a question for Dr. Gibbs now. So Sean, in thinking about cross-sector collaborations, we've talked about this theme already a lot in this discussion. Can you share an example of a partnership that you've yourself or your school has been involved with that successfully bridged the research efforts that an academic school public health would bring with public health needs and impact?
I'm going to talk about one that's in process right now. So for probably almost a decade right now, Texas A&M University, our School of Public Health, pharmacy, nursing, medicine, we've all been involved in essentially an opioid working group, looking at the impacts of opioid across the aging spectrum. And within the past year, the Texas Comptroller's Office just awarded the School of Public Health and our partners $25 million to address opioid-related issues in K through 12. So you cannot just walk into a school district and start implementing programs or educational materials. It involves not only coordination at the state level, but coordination at the school board level. And our team is now working across the state of Texas, and they are balancing work with the local health department, the local school districts, and trying to get everyone on the same page as to what the challenge is within the community and how best to go about addressing it for that specific community. So it's not just, hey, here's the money, now we're going out and implementing programs. And I think Dean Goodman mentioned something along this lines in her earlier opening response. We're talking about the value of those communities, listening to their feedback. And that's something that we're encountering on a weekly basis with this project. The researchers are working with the community members, the local health department and the school district, and they're routinely finding out things that are unique to that situation that require tweaking and changes to what we're planning to do to help students not engage in trying opioids, but also to address those who already have or are in the cycles of addiction there. So that's just one example off the top of my head, literally, since I wasn't doing this a couple hours ago. So that's just one example there. And I think that example is germane across the country. I think that's something that we're all tackling when it comes to our youth, when we're talking about how the youth are coming up within the communities and what they're being exposed to and when, and what the appropriate public health intervention and involvement is to steer them in the right direction so that they can be as successful as they can be in their K through 12 academics, and then go off and do wonderful things once they enter the college or the workforce. So.
Thanks so much. A great example of this full ecosystem that we've talked about and how the roles play together. Tim, I'm going to move to you to then just ask, how does ASPPH help amplify that kind of impact of academic research in the context of this ecosystem, particularly to policymakers or other kinds of external partners?
Yeah, thanks for that question. And, just to reinforce what Sean was saying, I am fortunate to be able to hear from the associate deans from research and faculty across our membership about the kinds of community engaged research that they're doing and the lessons that they've learned. So Sean gives a fantastic example, and I've heard 20 others that are similar. And so what we try to do are a couple of things. One is we have formed task forces to study particular issues. The one that we recently put together was around healthy longevity and really trying to look at the value of making sure that folks across their lifespan are healthy so that when they are older, they will have a better quality of life. And so we pulled together experts from our membership across the country to put that report together. It came out very nicely, if I do say so myself, and we are now socializing that report with the Department of Health and Human Services. We were Dr. Linda Freed, who was the chair of that task force, was briefing the director of the National Institutes of Aging, Dr. Richard Hodis, last week on the report and received a very favorable response to that. And we're going to be working to try to have some of our recommendations that both go to our membership as well as to the broader community and the federal government to try to move the needle in terms of thinking differently about healthy longevity. That's just one of the ways we do it. But then we also spend a lot of time with members of Congress and their staff, really trying to make sure they understand the impact that our schools and programs are having on the ground through their research, and that they're not just going into communities and saying this is how you should do things. They are doing the research to show what's actually effective and impactful for folks at the local level. And that's why the research in academic public health is so important. It's much more translational than some others. Not that basic research in other areas isn't critical too, but our research really has a more direct, quick impact for people on the ground. So we try to really make that case to federal policymakers to make sure that they're funding that kind of research.
Thanks so much, Tim. And I love that you brought up the longevity project, an example. And ASPPH has done multiple of those over the years. And as you said in the earlier times of today, that's the kind of stuff we would love to be doing more of, in terms of how we promote and move research forward together across member schools and programs. So I hope we return to be able to pick the next of those and keep moving forward together. That's the inspirational stuff that really drives us all and why we have a passion for public health that brought us here. So thanks for that. I'm going to switch gears a little bit now and return to Dean Goodman to ask you, as a dean and a person in our field, I think a lot about our early career researchers, our early career faculty, and even our students, and what today's funding landscape looks like in the research context. Can you share how you're thinking about this?
Yeah, I think it's a real challenge to be an early career faculty member right now. I think what we've been trying to do as our school is use as much human capital as we can. So we've really been investing in our junior faculty, having conversations with senior faculty, trying to bring them together to have key discussions about how do you go on the job market? How do you apply for this grant? No one knows the answers, but I do think those kind of open conversations let us get to better ideas and solutions than we would have alone. I think we're doing that also with our doctoral students, really trying to invest our human capital in them. And I think the other thing we're trying to do is open up our networks to our early career faculty. I think some of us forget that we've built these networks over our careers here, and we probably have larger networks than we would care to think about. But it usually takes someone to open their network to someone else for them to start to build their network. And so we've really been intentional about the human capital aspect of this and using our human sort of capital to make sure that we're pouring into our early career faculty members.
I love that. I love that you bring up the kind of sponsorship mentoring idea, that opening those networks is also means sponsoring our early career folks in their research and other endeavors across those networks. So thanks so much for that. Sean, you wanted to jump in?
Yeah, I think Dean Goodman hit on a number of brilliant points there. And I'd like to point out you've got three deans on this panel, all who started our careers a couple years ago. And Dean Goodman mentioned right now it's hard to be a junior faculty member. And we could go into 15 different reasons why. I would say it is harder today to be an assistant professor starting the tenure track than it was for me when I did that in 2002. It's very different landscape. And Dean Goodman talked about the importance of letting those assistant professors know we acknowledge that, and there's support and there's a pathway to move forward. But also, I think it's important to really talk to some of those senior full professors as well. Too often people divert back to, well, when I went through it, we did it this way, or this happened, or I had to do this, so you had to do this. And they're different worlds. The 80s, 90s, early 2000s are very different than it is for people in the 2020s going through the tenure track. And I've been spending a lot of time the past few months working the halls and just talking to the entire faculty as much as I can about what those changes are and how we can effectively navigate and push forward our research and the careers of our junior faculty on that. And when I say junior faculty, I'm also including postdocs and our future colleagues who are going through all of our doctoral programs. So I think it's important that we not lose the generation of junior faculty and upcoming junior faculty and researchers who are trying to navigate this situation in a way in which no one else has had to navigate it before. So, Dean Goodman, thank you for bringing that up. I really appreciate it.
Yeah, thanks so much to both of you. I'm going to go back to Dr. Gibbs again and pivot once again. And that is, I think it's implied in some of the things that you have said and that Dean Goodman has said, and Tim so far, but that is, how do we articulate the value of academic science as a way to promote understanding that pushes forward tools for prevention and promotion in our communities?
So I'll use an example of a project that's going on right now here at A&M. We received about a year and a half ago, $5 million from the Centers for Disease Control to look into and work with a variety of different groups on H5N1 in the agriculture industry and particularly how it's impacting workers. And one of the reasons why that came to us is because what Dean Goodman said earlier in her remarks, the networks that we all have. We could energize those networks and pull in other universities, pull in other researchers who could help answer the questions that nationally were being brought up and that were being brought up within the poultry and the cattle and the dairy industries around how they move forward with the new reality of H5N1 coming into their animals and potentially their workforce. So we had a number of our researchers and honestly a number of our student researchers out there as well who were multilingual, working with the people who are milking the cows, who are taking care of the layers, and talking about what they're encountering in the daily basis. And how that impacts what they can do to protect themselves and what are some of the other research needs in there. On Monday, I'm part of a workshop for the National Academies that's looking at this issue and looking at PPE in the agricultural industry. And a lot of the research has not been done because some of the industry is worried about increased regulation, and they want to do what's right, but they don't necessarily want increased regulation because of it. And I'm not saying that's right or wrong. I'm just saying that's the feedback we get. Whereas when you're talking about academic researchers versus state or federal researchers who are coming in, it's a little bit different. We're a land grant, we're a sea grant, we're a space grant. They're used to seeing our ag extension partners. They're used to seeing our vehicles going back and forth across their facilities. They're used to interacting with our team. So we've got that buy-in that Dr. Goodman was talking about being so important, so that they can help us address those research questions, but they're also sharing other things that we didn't know we should be asking. They're sharing with us because they're seeing us as someone who's trying to solve the problems. And when I say they're sharing this, I mean from a facility operator support as well as from the guy in the field making sure the animals are fed. They're saying we're encountering this, and we're able to go back and really work to bridge that kind of gap that's kind of exists or kind of evolved over the years and has really increased in the past few years in regards to how they look at governmental research and governmental interventions. Additionally, I'd like to highlight the importance both to what we're doing now in research and to the previous question. And that's foundation partnerships, that's alternative funding streams. I've got a couple researchers here who are working with Methodist Healthcare Ministries in South Texas, and they're addressing water quality issues in colonias along the US-Mexico border. They're addressing it from a research standpoint, and they're addressing it from an applied practical health outcomes standpoint as well. And that's because of the partnership with that NGO that is in those communities and helping to identify those issues. So I'll turn it back to you, Dean Fallon.
That's great. Thank you so much. I love those examples. Thinking of ones here in Georgia, similarly community-driven questions around what are the chemical exposures that our communities have because we're next to, a longstanding industry, and our researchers being able to do the measurements and the collaboration with those communities to advocate for change in their own communities. And that's a prevention strategy that is, hopefully upstream of the health consequences of those exposures. I love that. So Tim, I'm going to jump back to you, and maybe this is a pivot, maybe not, but we've thought about the challenges for our early career faculty. We've thought about the challenges for research operations in general and the advocacy work that you're doing. Can you say a little bit more about the research section work and how ASPPH, through convening of that research section, is supporting, these infrastructure things, cross sharing of ideas about how to manage research portfolios, about how to give the best opportunities for our faculty, staff, and students to do research, et cetera?
Sure, happy to. So the research section meets in person at our annual meeting, but we also meet quarterly. And especially in that research retreat we have every year, we really try to take on the top topics of the day, whether that's facility administration costs, like I talked about, or how to structure community engaged research, or frankly, how to support the students who are involved in this research as well, because many of them are concerned about their futures as well as the young faculty. And the great thing is that our members come prepared and give their perspective on how they're addressing one of those topics. And then the group gets to discuss other ways we could be benefiting our schools and programs, and also just how they can learn from one another. And this translates into, a lot of times it translates into policy recommendations. A few years ago, ASPPH produced some research recommendations related to research and partnerships with the federal government, and trying to improve the process for how the federal government supports public health research, including things like population health research. And these are the people who understand the nitty-gritty of how grants are administered and implemented at our schools and programs, so they know what could be better. And so I think sometimes the focus is on how, there's been so much change at some of the federal funding agencies, which has been disruptive. That's true. But at the same time, we have to be prepared to offer our perspective on changes that could be made that would improve the system and help our researchers make a bigger impact on behalf of everyone across the globe. And so that's the great thing about having a section and an advisory committee that can be strategic and think forward about what we should be doing to improve the research so it's more impactful.
Great. Thank you all so much for these. I think we have time now to open up to the questions that we're seeing online. And so I'm going to do my best to sort of pull themes together as we go through. And I'll start by saying, Dean Goodman, you sparked a lot of interest with your AI innovations responses. So there are a couple of questions along those lines, of one of which was, do you have any ideas about ongoing studies on media and health literacy or dissemination improvement already using free and community accessible large language models like ChatGPT?
Definitely not my area of expertise. So no, I don't. I hope we're doing that type of work. I will say that we as a school have really been thinking about the implications of AI, and our Center for Bioethics is now proposing a new degree, a master's in technology ethics, where we're really trying to think through, I think, some of these tough questions around some of the implications of this great new tool.
Great, thank you. And I'm going to add the next question, and for any of us to answer. Oh, go ahead, Tim.
Jump in on that?
Yeah.
So this topic of AI and also trying to be accurate in responding to public health dialogue, especially mis and disinformation, has been a big topic of discussion, especially at our annual meeting. And we now have a task force focused on the future of AI that is going to be coming up with some recommendations for how we think schools and programs should be handling the responsible use of AI. And we've also been trying to make sure we give people an opportunity to think about ways that they can productively respond to mis and disinformation. And the use of AI, I think, is going to be a great tool in that, as long as we use it responsibly.
Thanks so much, Tim. And Sean, I see your hand up.
Oh yeah, I'd like to jump in on this one as well. I agree with what Dean Goodman and Tim said. By the way, to those asking questions, Tim and I are trying not to take offense that none are directing to us and all are to Dean Goodman. But I mean, I get it. I get it. No, one of my associate professors, Keishan Schmidt, he had a paper that came out in Science, I want to say about 18, 20 months ago. And it was all about the importance of AI governance. And not only the utilization of AI, but the structures and the parameters that go around how that AI can be used effectively, ethically, and legally to push everything forward. And we're all running large organizations and involved in even larger organizations. And as many AI opportunities that pop up, I would say probably once a week or once every other week, I get contacted by one of my legal groups saying we can no longer use this one because their governance structure doesn't allow for X, Y, or Z, or doesn't protect the data that we're putting into it. So I completely agree with Dean Goodman and Tim, and just really not only how we utilize it, but just the back end of once we put things into the AI, how is that corporation, how is that application, how is that tool also using the information we're feeding into it?
Thank you so much. And a related point that if anybody else wants to comment on, but I want to highlight, it came up a little bit already in our discussion, but one of our colleagues at GW, highlights the yin and the yang of this AI excitement in the ecological costs and the environmental cost. And if any of you want to say any more about how you or your schools are thinking about the challenges with data centers or other AI tech that may further harm particular communities.
I think it's unclear fully what the full implications are going to be, but I think we need to be having those important conversations. And I think we need to think about, as with all things, the communities that we choose to put things like data centers in and what are going to be the implications for those communities. We often talk about jobs, but we often don't talk about what are the potential health implications. And I think we need to do both.
I completely agree. By the way, I love that this question came from a grad student at GW. One of the other things that I would talk about is nationally and globally, water is a very important resource, and data centers for cooling and other things use a lot of water. So particularly as we're looking in the US Southwest and in the plains and some other places around the globe, the heavy use of water, the heavy use of power when our national power infrastructure, the grid's a bit fragile, as some of us have found out in recent years. So when you're adding in these things that are consuming high levels of electricity and high levels of water, there are immediate real implications as well as long-term potential environmental implications as well.
Yeah, and obviously this is a very hot topic at the federal level, both the regulation of AI as well as the concern over the environmental impact of AI. And so right now you're seeing more of a laissez-faire approach to that, but I think increasingly as we get more and more data centers, we're going to have to face some of the impact issues as well. And I think, we as schools and programs of public health who are doing this cutting edge research need to use the tools of AI, but also understand the implications of it.
Thanks to all of you. I'm going to jump to a different theme of questions. And this one is a super easy one. Don't worry. It is. What are the best practices for academic institutions to navigate the financial uncertainty and pressure from funding partners while maintaining our integrity and independence in public health research?
Well, I can try to start that one off if you don't mind. These are definitely the most challenging, as Sean was saying earlier, these are the most challenging times academic public health has ever faced since it started. And so we don't have great answers, but here's what I would say is that there is still research funding. It's still flowing. And, our institutions need to still compete for that funding. We'll see how it all plays out in terms of whether or not you'll get that funding, but it's important to not give up on that effort because that's critical for the future of the field. And in order to navigate that, I think it's important for you to be working across your institution, whether it's with your research dean, with your university, with your legal counsel, to make sure that you're doing everything you can to protect the research that you have and move it forward. And I do think that there's a lot of attention right now on public health. It's sort of the topic of the day, but I do anticipate that will wane and we will eventually get back to a little bit more of a normal flow of this. So if you can weather this storm, I think it'll all pay off in the long run, but I know there's pain going on in the meantime.
I'll hop in with, oh, sorry, Melody, did you want to go? Oh, I'll hop in and expand on what Tim said since, this is the easy question, right? I think that we're going to have to shift mindset here a little bit. And this is something that we started down here at A&M about 6-7 years ago. One of the messages we've been giving to all of our faculty across the board is if it's competitive and external funding and it pushes your scholarship and your research forward, it counts towards promotion and tenure. It counts towards your annual reviews. And I find myself in an odd situation where, yeah, we've had millions of dollars of federal funding paused, and then honestly, some of it unpaused and given back to us. So we've had that impact, but we're also at a point where we're having record new research and record research expenditures this year that were phenomenally larger than last year. And that's because we're looking at non-traditional funding sources. We're looking at non-traditional partners. Now, as you start engaging with some of those non-traditionals, the question on this comes up, which is how do you maintain your research independence? And you have to establish those parameters, those safeguards right from the get-go. When you're engaging with an industry and you're answering a research question that you have and the industry has, You want information to flow back and forth, but you don't want them to tell you what your results can and cannot be. You want to find out if your understanding of how they're doing X, Y, or Z impacts environmental emissions, and understand if you're interpreting it properly, but they can't push where your findings go and don't go. So that has to be part of the agreements up front. That has to be established from that first conversation, and you have to have that guide rail there throughout. And you have to have deans like Dean Goodman and Dean Fallon and their research team. My senior associate dean for research, Dr. Tiffany Radcliffe, her and her team have been doing a phenomenal job about navigating this, where we're partnering with NGOs or industries that previously we hadn't. And as you're engaging, you're letting them know what the parameters are for good scientific research, and that regardless of findings, regardless of what comes out of this research, it will move forward.
So I will just add that I started my career as an investment banker. And so the first thing I would say is diversify your portfolio. And that is true across all aspects of life. You should diversify your portfolio. And I think the other thing that I learned from banking is that challenges leave potential opportunities to do things differently. And instead of just thinking about the challenges, I think we need to reframe it and start thinking about how can we do things differently and better than what we were doing before.
Thank you all. I think we have time for one more theme of questions. And so I'll pull at least two that are around this same theme. And that is, I think, communication, if I'm reading into it. So the first question is, what strategies can academic institutions in public health, medicine, and science adopt to ensure consistent communication of empirical data across the US while addressing community-specific interpretations and minimizing negative or misleading narratives that foster skepticism and fear? So that, I think, is a big question of the day. Before you answer, I'll just add on a recent question that said, particularly interested in deans from red states, how are you navigating partnerships and communications with your practice partners as they face ever-growing and unclear restrictions on what they can say and do?
Don,
Am I allowed to call not it on this question? No, I'm kidding. I'll hop in here. So when it comes to communications, we have to be a little, not a little, we have to be a lot more deliberate in our communications. And I say that as a dean here in Texas. I have to be very deliberate about the communications I put out. I have to be very deliberate about that goes outside the school and honestly inside the school. We're still doing great public health work. We're still doing great public health research, but we have to be very deliberate in those communications. And I would pull that back. Recently, like many people my age, I've had to deal with aging of relatives and medical care. And one of the things that when dealing with my mother's health issues that I was surprised by is she did not understand within healthcare that it wasn't one size fits all for everyone. She did not understand that they had to take into consideration all these comorbidities. They had to take into consideration everything about her, and then it wasn't just you have X, so we give you Y. She didn't understand all of this, and I think we have to do better at communicating when we don't know, straight answers to questions, or when the answer to questions vary depending upon what other things are happening in your life, where you're living, what's going on. And I think for the majority of the population, they think science has one answer. They think that this is the question, and if science has an answer, the answer is B. And that's just not the case many times when you're talking about healthcare, your own health, or even public health. Things that Dean Goodman can do there in New York, I probably can't do in some of the areas down here in Texas, and vice versa. You have to adapt it to your population, your community. And then I'll be quiet.
Thanks, Dean Gibbs. Dean Goodman, do you want to say anything to this point about communication?
I think we have to do a better job of telling the story and admitting what we know and what we don't know. I think sometimes when you're a scientist and you say X, people think that that is a fact, right? Like the scientist said X. But I think it's important for us to say we don't have all the answers, but here is what the data suggests. And we need to do more research like we really need to communicate, I think, to the general public how science works. I think a lot of us have forgot that like I always tell my students it's research. When I ask them to go back and do something again, that re in front of it is because I'm going to ask you to do things over and over and over again, right? And so I think sometimes we don't communicate to the public how science works, that we're going to have to do things likely over and over and over again before we get to what we can all consensus wide believe is the right answer. And I do think we have to do a better job of telling the story. And this is from a biostatistician who I can look at the data, but I often think that sometimes we don't tell the personal narrative. Like Dean Gibbs just gave a great example of his mom and her experience. I don't think we always do a great job in public health of telling the story behind the data and personalizing it.
Yeah, I just want to say that I think our schools and programs are starting or have realized this, and you're seeing schools that are putting their researchers, right on camera and talking about not only the basics of their research, but the impact that it's having for people across the country. And I think we've got to do, as Dr. Goodman just said, we've got to do more of that kind of talking right to the American people about the great impact that public health is having. I mean, we know that the MAHA movement is all about trying to make sure that people are more healthy. We all agree with that. And I think public health has been doing that for a long, long time. But there is a bit of a disconnect that we can help bridge, I believe.
Thanks to all three of you. I will just add Rollins School perspective. We agree completely. And many schools have now invested, like we have, in a science communication certificate program, and training our own faculty and staff as well as students to be better communicators across multiple different forms of media in the context of speaking directly to our communities. Doing work, I want to give a shout out to Denzel, who is a grad of NYU Global Public Health, Dean Goodman, who is now a PhD student at University of Albany, who highlights things like storytelling circles and peer health ambassador programs, even arts-based interventions. And so I think it's a call to all of our schools who are already thinking this way, but could move even more forward in thinking of creatively about how we do this kind of communication, particularly about the research that we do and its impact. So with that last note, I'm sorry if we didn't get to every single question. I tried very hard to get to you all. Thank you for being so engaged in asking those questions of us. And thanks so much to our three panelists for all of your work you're doing in your own lives, but then also for taking the time to be part of this ASPPH community and have this session today with all of us. I will go to make sure I have any other house cleaning options. What I will say is, remember, this was recorded and you will be able to access it after today's event. And on behalf of ASPPH in particular, thanks for being here. You'll see that QR code where you can find this information. And a particular shout out to Tim Leshin and his team. If you have additional questions about research or advocacy and even communication as we just ended, please reach out to his office. Thank you all so much.
Thank you. Great. Well, what a great job you did, Danny, in moderating that session. Thank you so much. That's great.
And to the two of you,